Ladies and gentlemen, lend me your loudest applause to welcome our distinguished speaker, Datuk Dr. Selvam Rengasamy on stage for this lecture on osteoporosis, preparing for prevention.
Good evening. Last lecture of the day will be the data lecture that needs to be finished quickly because all of us will be tired. But following this, there is a panel discussion here. But before that, today is Dr. Carol's birthday. So we will wish him on behalf of all of you all at Saham a very happy birthday. He'll be here soon. I met Carol maybe about 10 years ago in Thailand. Since then, he had been a very good friend, a mentor. To be honest, if not for that guidance, I won't be standing here and lecturing, and I may not be the president of Saham. So it gave me a lot of opportunity to learn, the courage to be on the stage and share my knowledge with you. So may God bless him with a much longer life. And all of us have one thing, both of us and most of the lecturers here, we have one thing in common. Life for the purpose of exploring what is life about by living it. So the purpose of life should be to share. And the way I share what I can to the humanity is what I possess as knowledge. We all can do much more. This is the best I can do. Okay, I want to emphasize a few things about osteoporosis. I'm not just going to talk about loss of bone. Let's look at osteoporosis from certain points which is need to be emphasized. There is little point in treating osteoporosis once it is established. And even if a diagnosis of osteoporosis is made, you will have many natural alternatives. So what we are going to do is to try to change the thinking of osteoporosis as a systemic disease and presenting as bone loss. So it is not to be thought of as a bone loss disease. The reason is because there are many underlying causes, and each one of these underlying causes can have more implications on the health. Say, for example, if you are deficient in magnesium, you can have osteoporosis, but the magnesium deficiency can also give you hypertension, headache, and cramps, and so on. Testosterone deficiency can cause osteoporosis, but testosterone deficiency, so like for example, if it is testosterone deficiency as the underlying cause of osteoporosis, it could lead you to suffer heart disease, obesity, diabetes, and so on. So look at osteoporosis as a presenting symptom of an underlying cause, one or more causes. So I would like to call this as a systemic disease with a localized presentation. And bones are important because it's part of your hematopoietic system, because bone marrow is in. That's where you have your antibodies, immune cells. Now it also offers structural support for muscles and internal organs. It's very important. If you have fracture, sometimes you have internal organ damage. A big portion of what bone does to you is to act as a reservoir for minerals. And these minerals, they are vital for nerve functions, for organ and muscle functions, and for electrical conduction. So the minerals must be preserved. If you lose bones, you also lose minerals, because often what we replace is calcium. For bone, we give calcium for bone health, and we replace calcium for bone loss. So osteoporosis means it's a reduced reservoir of essential minerals. Now, bones and muscles are alkaline reservoirs. So whenever your body is acidic, you will have bone loss. So it's just not about calcium, it's about acidity as well. Acidosis precedes osteoporosis. So you have to look at it as a systemic disease. You have to look at all the underlying causes to understand the root cause And the main part of the lecture is going to be, when do you start the prevention? Okay? So underlying causes, for example, what I mentioned, if you take testosterone itself, you will have increase in fat mass, increase in insulin resistance, more heart disease, and more chronic inflammation. Just to give you one example of what the underlying cause can do if you do not address it. So there are many fractures. This is not the latest figure. There are hundreds of thousands of fractures happening around the globe. Like all other diseases, osteopenia and osteoporosis, can you hear? Okay. Osteoporosis and osteopenia is happening at a younger and younger age. Younger people are getting affected. Osteopenia happens in children as well. So this is what you see. It's not just about osteoporosis happening at a younger age group. There's the same thing happening with diabetes and cancer as well. Am I right? Okay. Males are not spared. We always like to think that we don't get osteoporosis like women. The problem is it is underdiagnosed and undertreated. And most of the osteoporosis happening in men is because of steroids, alcohol, or testosterone deficiency. This is a very important cause. And 20% of the vertebral and 30% of the hip fractures occur in men. So men should take care of their bone strength as well, bone mass. So prevent and treat the underlying cause or causes naturally. Osteopenia leading to osteoporosis occurs early. This is the most important point that I want to stress in this lecture. All these conditions happened early in life, which means you will have to focus. If you are a better doctor, you will focus on in utero osteogenesis. But if you are trained by Saham, you will focus in the pre-conception period. The understanding or thinking now is that diseases before conception. If you can prepare a woman to be healthier before conception, you avoid many of the childhood and adulthood diseases. Provided, of course, the baby is breastfed and a good healthy diet is carried on, exercise, sun exposure, and all other pillars of health are looked into. So the best way to prevent a disease, if you talk about osteoporosis just as an example, is to work with the mothers who are expecting or planning to conceive before pregnancy. But unfortunately, this does not happen. Not many women, even in my practice, come for a preconception check. But when you have an opportunity to see these women during pregnancy, you could do a lot. So pregnancy, I always tell my patients, is not about doing a 3D or 4D scan. I still do black and white scan. Because you'll find out everything, except taking a nice photograph on 4D. And you know how often we get a nice picture that you see in the journals of the fetus face? Just once or twice a month only. It takes about half an hour, 45 minutes of struggling to catch, if at all you are lucky. And most often the picture is not clear. So that there is always a concern about exposure. And it's a new technology. So what I tell my patients is a lot more you can do in pregnancy to ensure the fetus is healthier. So the babies can be born with much less respiratory distress syndrome, much less neonatal disease. They will have better immune system, they can have stronger bones. What first known is children can from this side and they fracture. And the reason told to us is because they don't drink enough milk. So we pour milk into their mouth. So start in the preconception or intrapartum. So ensure that the mother's diet, focus on diet, alkalizing diet preserves bone mass. Acidic diet leaches bone. Ensure there are enough minerals, vitamin D, This should be part of your supplement. To do a test before giving is better, but if you are choosing a dose between 1 to 4,000 IU per day, it is almost unlikely you will have vitamin D toxication unless you use 50,000 units for months. So the common doses that we advise, you will hardly ever see a problem. It's very important to optimize the insulin and homocysteine levels. I'll explain to you why. Prevent premature delivery. Now, how do you identify the risk for women who may have premature delivery is, number one, correct their thyroid deficiency. Very, very important. If you want to reduce the risk of threatened abortion, miscarriage, and premature delivery, as well as to reduce the respiratory distress syndrome, neonatal jaundice, have more hair on the head, and boost their immune system, boost their memory, boost their intelligence, the one thing that you can do is to optimize thyroid hormones, pre-pregnancy or at least during pregnancy. The other one is to recognize symptoms early, especially if they have muscle cramps and water retention. Muscle cramps is magnesium deficiency. The same thing can happen in the uterus, leading to premature delivery. And the third risk is excess estrogen and deficiency in progesterone, and the history will be either heavy painful period, a woman who has had fibroids, ovarian cysts, and endometriosis or breast lumps, or someone who has had a lot of PMS. These are the risks, these are the pointers towards progesterone deficiency. So if you understand this, you will reduce the risk of premature delivery. Advise exercise and sun exposure during pregnancy as well. So vitamin D deficiency in childbearing age, women, it's very common. And not just the European countries, you have a lot of vitamin D deficiency in tropical countries as well, especially the Middle East and Africa. So there is increased risk of osteoporosis and medical disorders because, as I mentioned, we should consider osteoporosis as a systemic disease. So it's very common. Increased risk in the younger generation is what we see now. So does this mean that you can prevent this by fortifying milk with vitamin D or giving them calcium supplements? So when you use fortification, remember the vitamin D could be D2, not D3. And the dose is so small, it may not even promote osteogenesis in a mosquito or a rat. Yeah? So don't look at fortified food as a way of preventing disease like vitamin D, fortifying the food with folic acid or iodine. They are good by themselves, although the dose is too small to have a clinical benefit. But the problem is the food itself. If you put good thing into a junk food, you should worry about the junk food and forget about the good thing, because this junk food is going to kill us one day. Correct? Breakfast cereals are killer foods, killer breakfasts for young children. So what's the point of fortifying a junk food with a small dose of vitamin D or folic acid? Yeah. So beware of this fortification of food and milk. Infants and toddlers, are they having optimum vitamin D? Certainly not, because those days newborn babies they always enjoy sunbathing. What the parents will do, they strip them naked, cover the eyes, put them out in the sun in the morning. 15 minutes, 20 minutes, half an hour every day. This is how babies and newborns and toddlers made their bone and mothers breastfed. Now the babies are indoors most of the time, so when you measure the vitamin D levels, deficiency is seen in 12.1%, insufficiency in 40%. Okay? And this is more common in darker skinned people. So suboptimal levels of vitamin D is very common in infants and toddlers. So when do you think osteopenia and osteopenia leading to osteoporosis occurs? Very early. But when do we focus on bone health? very much later in life. In bottle-fed infants, deficiency and insufficiency is common despite food fortification, so don't fall for this trap. Increased risk of rickets in childhood. I was sitting in the next room. Marcus showed the slides of vitamin D, the incidence of rickets that's actually on the rise. That's a fact. It came down for a while, now it's rising again because we do not expose ourselves to sun and we are deficient in vitamin D. I'm just talking about vitamin D. There are many other nutrients for bone health. So when you have this problem, you have a higher risk of hypocalcemic seizures, you have growth failures, lethargy and irritability, frequent respiratory infections or other infections, and long-term health effects. So it is not just vitamin D, it is just not bone health. Neonatal and childhood osteogenesis. So if you can get the best opportunity, it should be before pregnancy. If not, the second best opportunity is during pregnancy. If for some reason we have missed both, at least focus in this age group. Breastfeeding is very important because breast milk calcium is 100% absorbed. Breast milk cholesterol is 100% absorbed. So that's the best food. For the first 6 months, after that you have to introduce solids. If for some reason the mother doesn't want to breastfeed, for so many reasons, actually my patients will have 101 reasons. As soon as they open their mouth and say, this is a reason why I cannot breastfeed, I'll close my ears. Because nothing makes sense to me. If you want to have a baby, you will produce milk, provided you want to breastfeed, isn't it? Because the sensory input for breastfeeding, lactation is very, very strong. It is attached to emotions. So if at all breastfeeding didn't happen, try to advise them. Advise them to stop bottle feeding after the age of 6 months and switch to solids. But what happens is they continue feeding bottle milk. Am I right? Because the trap is already set and they come up with this milk from 6 months to 1 year, and from 1 to 2 years I have added more things and it is better for the bones and brain. From 2 to 12 is better milk, and then you have all the brands that is supposed to make them win sports. Have you seen those advertisements? I wonder where they get the facts. Whereas if I say vitamin C is useful for you, I have to establish so much of facts. Yet what they do when we talk is, they don't want to listen. Yeah, it is such a cruel world. Sun exposure, exercise, and this is what you should look at. Dairy products, because it's highly acidic, does not make your bones stronger. Sugar, carbonated drinks, and gluten. And make sure the children, newborns and childhood stage, they get an alkaline diet. So let's look at bone, and then we look at how bone is made and what can you make to keep the bone healthy. So bone is dynamic, constantly made, constantly broken down. So once it's broken down, new bone is laid. That is how bone functions. It's not like muscle. So the osteoclastic breaking down of bone, it's shorter. So the osteoblastic rebuilding takes longer. So if you want to see the beneficial effects, you should give minimum of 3 to 6 months. You do not see changes soon. So that's why this slide is here. So give it enough time if you want to do any measurements. So you have different types of bone cells. Of course, all of you all know this. Osteoclasts, breaking down bones. Osteoblasts, that builds new bones. Then you have osteocytes that are matured osteoblasts. And you also have the bone lining cells on the cortical bone. Okay? These cortical bone cells act as the first reservoir for calcium. So if for any reason calcium need to be removed from the body, say you have an acidic body, the body will, what the body will do is it will leach minerals from your bone and muscles to balance the acidosis. This is why you lose the bone actually, one of the reasons. So the first area where bone is lost is from the cortical bone. So for osteogenesis, this is the only thing that is spoken about that is wrong, and it is very inadequate. If you do not have other factors, you won't get the calcium into the bone. I'll explain later. But the type of calcium that is sold commonly is also wrong. It should not be a calcium that cannot be absorbed. So we will look at that as well. But you need magnesium, phosphorus, potassium, silicon. There is a lot of new information on boron. Selenium, we all know. Strontium, manganese, copper, molybdenum. So there's so much you need to make bone. So you can't make it with calcium. But everybody tells calcium makes bone. Yeah? We don't even talk about vitamin D. It's only if we are trained in nutritional medicine, we look at all this. So you also need vitamins. C because it's collagen. C because it recycles glutathione. And vitamin D, we will look at it. Vitamin K, you need to understand this very well because more information has come into human health with vitamin K. So it used to be clotting, correct? Vitamin K dependent clotting factors. That's all we studied. Then of late we realized that vitamin K is very, very important for bone health. Now we know vitamin K has got other systemic health as well, health effects. You need B6, B12 and folate because I'll show you a slide where homocysteine, if it is high, more than 9, you can also have osteoporosis. So if you do not test your patients for fasting insulin and homocysteine, you will also miss a big chunk of these people who are going to suffer from osteoporosis. Collagen is important. Alkaline diet, I've mentioned, enough protein is necessary. But too much protein is acidic diet. You need to exercise. The type of exercise that would build bone would be resistant exercises or impact exercises. Yeah? Very often I'm asked this question, so does it mean that yoga is not good? Yoga is one of the beautiful exercise, so is Tai Chi and Qigong. Yoga is not exercise. It's learning how to live your life. It is the principle. It is life itself. It is behavior itself. It is not just an exercise. It is a way by which you can explore the purpose of living. Why you are here, why you need to live. So people look at yoga only as an exercise, but it's much more. But whatever it is, yoga is one of the very good exercises. But when it comes to muscle strength and bone strength, you need to do weight-bearing exercise. Okay? But it's a very good exercise as for flexibility. Sun exposure is very important. Unfortunately, children, they have sports activities, not every day like us when we were young. They have some days sports activity, but that is usually around 7 to 7:30 or 8 o'clock. It is bright, but you do not make vitamin D at that time of the day. You need to be out at about 9:30 or 10, but before 10 in tropical countries. And you need to have sufficient exposure, not overclothes. And vitamin D you cannot make by sitting. Supposing this has got a glass roof and let sunlight inside, you will not make vitamin D. Sitting in the car, you will not make vitamin D. Fluorescent lights actually can reduce vitamin D levels. So the more you sit indoor, so next conference maybe we will have outdoor. Yeah? For a change. I can cut cost, you know. I can pass the reduction in cost to you. So you'll have your conference cheaper. Because we always ask, Doctor, why the conference are so expensive? To be very honest, we have been losing in the last 3 years. Because it's very expensive to run a conference. So what I do is sometimes I chip in from my own pocket to keep things coming. In fact, this time I donated some money to bring in government doctors by giving them 50% discount. You know what was the conversation? You give me 50% discount plus hotel accommodation. I say, well, all the information and knowledge about integrative medicine is out in the air, just go and pluck it. It's free. You don't even have to sit here, it's all floating around, just pluck it. So you must take the interest to know how to be better. You saw Marcus' slide? To know better is good. Once you know you are better, be better. That is why we always have modules 1 to 6 and then we carry on with fellowship. Because we haven't learned everything, have we? So there is much more to learn. So hormones are a major portion of building bone health. You have to have sufficient amounts of hormones, but there is one hormone in excess or two. Excess insulin will lead to osteopenia and osteoporosis. Excess cortisol can also lead to osteoporosis. All other hormones are actually anabolic hormones. So we will look at some of these. This calcitonin, there's a lot of new information about what calcitonin can do for our health besides building bones. So you also need growth factors. You can go back and look at some of these growth factors. And one of that is the bone morphogenic protein from osteoblast maturation. So if you have enough vitamin C and if you control your homocysteine levels, you will have better maturation of osteoblasts, and that will produce this morphogenic protein that helps with the bone formation. Of course, IGF-1, we all know, is growth hormone, and that is important for cell replication and division. Too much IGF-1 is not good. That is the reason why hyperinsulinemic patients and diabetic patients have higher risk of cancer. And unfortunately, diabetic patients, they receive insulin, increasing the risk of cancer significantly. So that's an entirely wrong treatment. Cytokines are important. Actually, these cytokines, it's a different lecture by itself. A small amount of inflammation, small amount of free radicals is necessary in your body. It's only when the pathway is hijacked and it becomes uncontrolled, you will have problems due to inflammation. And there are also membrane proteins. I have a slide on this, we can have a look. So how do you establish osteogenesis? As I mentioned, the best time is in childhood, but this is a step forward. The better is in utero, and the best way to get this done is before conception. So you need to know at the age of puberty you have maximum bone building. Prepare the child to have adequate bone building health, and when at puberty, you have the surge in hormones to make most of your bone mass. Once you miss this period, then you will never have enough bone mass in your life. So the best time is to build before the age of 18. Physical activity, sun exposure, vitamin D, calcium, other minerals, pH of the body is important. Now, if your puberty is delayed because of some of the hormonal problems, you may have delayed bone density in spine and forearm. One of the reasons is delayed puberty, but early menarche is also not good because the hormones will not be balanced. These are girls who have excessive amounts of estrogen, and which is very common. Osteopenia is, we all know, is thinning of the bone. Osteoporosis is already established bone loss. And that's the definition. Bone loss more than 2.5 standard deviation. Less than 2.5 is thinning. So achieve peak bone mass before the age of 20. So osteoporosis, one of the reasons is sugar. It's highly inflammatory and acidic. That's where you get it from, high carbohydrate diet. Children's, the bottled milk is sweetened. Cereals have plenty of sugar and they are given carbonated drinks. It's not just about high carbohydrate diet. They take plain sugar, plenty of just sugar in their life. And some of this sugar is not cane sugar, it's corn syrup, which is much worse than cane sugar. So this is the reason why if you do an ultrasound in children, a lot of them have fatty liver, just because too much of sugar in the body, which gets converted to triglycerides and deposited in the liver. Carbonated drinks, they have phosphoric acid and carbonic acids. They will leach the bone. And this is what I mentioned just now. High fructose corn syrup is very, very inflammatory. And remember, this is not used by muscle for energy. So it just sits there and becomes triglycerides and get into fat. Wheat, we have heard this many times. Gluten, gram to gram, wheat yields more sulfuric acid than meat. It increases calcium loss. There is a reference here. There are many references on this. Now coming to high protein diet, is it good? I'm not too sure about continuing a very strict keto diet or high protein diet. If you want to do it for a particular period of time because you have a medical disorder, or if you have a reason you want to lose weight, that's fine. But strict keto diet, it could be acidic because it's protein and fats. I would like to be moderate. If I don't have a medical disease, then if I want to follow a keto diet, then I'll modify, make sure it's alkaline diet. So I'll have vegetables. That makes sense. Atkins diet, of course, it works fine. If you're obese, you want to lose weight, yes, but it's very stressful for your kidneys and liver, very high protein, and moreover, it is acidic. So prolonged periods of high protein diet is not good for your bones because it's acidic. So if you increase vegetables to protein, if you have vegetable protein diet ratio of 1:1, hip fracture is 200 in 1000. If you increase this to 2:1, it reduces to 10 per 1000. That's the benefit of having an alkaline diet. Milk, we all know. The only thing I want to emphasize here is this. Breast milk is completely absorbed. Cow's milk is acidic and rich in phosphorus. Too much phosphorus doesn't make your bones strong. There is also an enzyme called xanthine oxidase. It is not brandy. Yeah? There is a brandy called XO. This is not brandy. So it increases systemic inflammation and uric acid. So there is nothing good about milk. And as you heard yesterday, Asians should never touch dairy products. As simple as that. There is not much of advice about dairy products from policymakers and governments, right? They still promote, they still advertise. So this is the sad part. What we want to do is to engage with the government departments. Maybe it's after the election to see who sits in the chair. We want to have a discussion about certain things that is worrying us, like coming very hard on us for vitamin C infusions and not recognizing integrative medicine. Some kind of discussion could help, but actually all along we have been doing a lot of work. When there was this dengue epidemic and a lot of people died, I gave a book, Thomas Levy book, with a lot of references to 3 physicians, top physicians in the country, and we explained to them. And we even suggested that we will provide them with free vitamin C and just do a trial. You know, the easiest way to convince the benefits of vitamin C is a viral infection. Any other disease is difficult. Any other supplement is difficult. Vitamin C is very fast. You only need a small number, 10, 20 patients, 10 on one side, 10 on the other side. You give your conventional treatment for 10, I'll give vitamin C for 10. And when do you get the results? Within 24 to 48 hours, you will see an improvement in the vitamin C group. With all these facts laid in front of them, they still close the eyes. And more people die, and they keep dying. So things have to change. Inflammation and bones, chronic silent inflammation is always an issue for many disorders, and by now we would have known most of them already. These are membrane proteins. We will look at it later. But inflammation increases bone resorption. Okay? Local production of platelet activated inhibitor and IL-6 also increase inflammation, and one of the common reasons for chronic silent inflammation is from the gut. A simple test that can give you an indication is CRP, but do the high sensitivity CRP, HSCRP. So think of gut dysbiosis, and it will be good if you can ask some of the symptoms of gut dysbiosis. So who are the children who are exposed, who have higher risk of osteoporosis? Are the very ones who are sick very often, taking antibiotics. Can you get the link now? So the more antibiotics you give it to children, the more osteoporosis they are going to have later on in their life. These are some of the other reasons. Glucocorticoids, it's not cortisol. It's not hydrocortisone replaced in safe doses. It is prednisolone. So it's synthetic steroids, high dose and prolonged treatment. How many of you have actually seen Cushing's patients in your practice because of prednisolone? Actually, we should never be seeing this. How many of you seen a Cushing syndrome because of hydrocortisone? How many of you have seen that a patient is dying or having side effects from vitamin C? You don't see. Even the normal dose of vitamin D, vitamin E, vitamin K, you don't see, because this is a difference. These are utilized by your body, recognized and utilized by your body as natural to the body, but not synthetic hormones, synthetic drugs. They are not recognized as natural to the body. Anti-androgens, especially the ones that are used in prostate cancer treatment, leads to severe osteoporosis that emphasizes the importance of testosterone for osteogenesis and bone protection. That's why some of the syndromes like Kalman syndrome, Klinefelter syndrome, you have higher risk of osteoporosis. Excessive alcohol, smoking because of cadmium, immobilization, chronic renal liver failures, and GIT diseases. These are the other causes that can lead to osteoporosis. And you have hypogonadal states, you have menopause and andropause. Men should not think that they can run away from this risk. Bilateral oophorectomy is a problem, because nowadays I see women even with 3 to 5 cm of fibroids. We would have never thought of myomectomy even, leave alone hysterectomy. But now they have hysterectomy for small fibroids. They have total hysterectomy and bilateral oophorectomy after the age of 40, even if they have a benign ovarian cyst. So where are we going wrong? We don't seem to realize the implications for future. So if you remove the ovaries, for ladies, the primary source of testosterone is the ovary. So you not only increase the risk of osteoporosis, you increase the risk of obesity, heart disease, brain lethargy, loss of libido. Premature ovarian failure is actually happening more often. Women used to have menopause from 50 to 52, then we brought it down to 48 to 52. Now 45, you can already see women are having scanty flow, and they have flow once in a few months' time. One of the reasons is autoimmune diseases, a subclinical autoimmune disease, because it damages the ovary. You should understand autoimmune disease is just a target, that's all. It depends on which target is hit. So if it hits the ovary, this is a problem. Sorry. Anorexia nervosa, this is a modern day disease. Turner syndrome, Klinefelter syndrome, Kalman syndrome, because of testosterone deficiency and estrogen deficiency. Cushing syndrome, thyrotoxicosis, any thyrotoxic patient is more likely to get osteoporosis. Hyperparathyroidism, I have a slide on this. Diabetes mellitus, mainly because of hyperinsulinemia and the acidic body. Cortisol, DHA deficiency. Cortisol deficiency is important. Cortisol balance is important because it reduces inflammation. DHA is an anabolic hormone, not as strong as testosterone and estrogen, but it is an anabolic hormone. Malnutrition and malabsorption, so if you have any one of these conditions, so don't go for this trend of gastrectomy and intestinal bypass if you want to control obesity. Rheumatoid arthritis, ankylosing spondylitis, SLE, amyloidosis, sarcoidosis, all these conditions lead to osteoporosis. But these medical conditions present to you first. Okay, homocystinuria is, I have not seen one, very, very high levels of homocysteine, probably more than 100. Homocystinemia is what we are seeing now, high levels of homocysteine. So unless you measure and you understand that for optimum health, the level must be below 9, okay? If it is high, just is as simple as giving them some B vitamins. That is why B vitamins help in bone health, if the levels of homocysteine are high. So it can lead to osteoporosis, spinal deformities, disc degeneration, spondylosis and spondylitis. So always check the fasting homocysteine levels. Another risk of osteoporosis is, another reason for osteoporosis is loss in muscle mass. So if you have low muscle bulk, you are more likely to have thinning of the bones, because the blood flow to the bone is through the muscle. The bigger the muscles, the bigger the artery, the better the blood flow to carry the nutrients. So this is another reason why you should do weight-bearing exercise to maintain your muscle mass. Both for men and women, women do not like exercising in the gym, carrying weights, because you think your muscles can grow big and you look ugly. It can never happen. It will not happen even if you replace testosterone in physiological doses. If you want to be like some of the American women in 2 pieces and show muscle bulging out like men, of course, you can overdose yourself with testosterone. It can happen. Not naturally. It will never happen naturally. And it cannot happen with physiological doses of TRT, testosterone replacement therapy. What happens is, besides this, when you have muscle weakness or low muscle mass or muscle loss, it worsens osteoporosis and the risk of falling is high. Immobilization increases osteoporosis. So once you fall, especially in aging people, they are bedridden. Yeah? So they have much more complications after the fall. So maintain good muscle mass. So the early symptoms would be backache, neck pain, muscle pain and bone tenderness. If you do not recognize this, then of course you can get severe backache, loss of height, sudden back pain because of fractures. You could have actually a fracture, any part, any bone. You can have kyphosis or scoliosis. Any other reason for kyphosis and scoliosis in childhood? Can anybody tell me? Yes? Hypothyroidism. I saw a few months ago a 16 or 18-year-old girl who had spinal fixation, stainless steel, for scoliosis. And she was very cold. So you don't correct hypothyroidism, but you try to clean up the gutters when you don't want to clean and do anything about upstream. So this is upstream medicine, where you understand the root cause. Okay, so these are the hormones. Let's go through one by one. Now the problem, the confusion or the hesitancy in using hormones is because even now, we doctors do not seem to understand the difference between natural or bioidentical and synthetic hormones. They are very, very different. Synthetic hormones are not natural. The body does not recognize it as natural. The body does not metabolize it as natural. So it does not get excreted. It gets clogged up in your system and it has got systemic effects. And yet synthetic hormones are registered and licensed by government of Malaysia and so in many other countries. And a typical example is contraceptive pills, which is given out as free contraception in hospitals to control the birth rate. I'm not saying don't take it at all, but for long-term contraception, it's not the choice because it's purely synthetic hormones. Okay, I have a slide which I'll show you. How many of you heard about this study on women using HRT? Has anybody why HRT was discontinued. How many of you use HRT? By HRT, I mean replacing synthetic hormones in menopausal women. We don't use the term anymore. We use BIHRT, bioidentical hormone replacement therapy. So how many of you still use synthetic hormones? The sale dropped significantly. It hit them with billions and billions of dollars. Then they came up with a new formulation using smaller dose. So what they tell you, just like statins, maybe some hypertensive drugs and painkillers, you are taking a very small dose. But they don't tell you that that is very potent. Or we do not take into consideration the cumulative effect. If you take one tablet, you are fine. If you take daily for 365 days, there is a cumulative toxicity, right? So synthetic hormones are not the same. Bioidentical hormones in physiological doses are absolutely safe if you want to live longer and healthier. This is very, very vital. So this is the study I was talking about. Women's Health Initiative study that was started in 2002, supposed to be over a period of 3 years. It was discontinued after about a year plus. The reason is because many women, the risk of getting increased breast cancer, more heart disease during this treatment. So it was stopped 3.3 years earlier than planned. But pharmaceutical companies did not stop and discontinue. They just went into hiding for a while, and now they are back in the market again, trying to convince doctors to use HRT at a lower dose. Okay, so it's just about money and profit. So testosterone and osteoporosis, a lot of fractures happen in aging men as well as women because of testosterone deficiency. A typical example is Klinefelter syndrome. You all know how a Klinefelter syndrome, adult male looks tall and hyperlaxity, small testicles, they are infertile, they have early onset of osteoporosis. That underlines the significance of testosterone. Low bone mass density in hyperprolactinemia, high prolactin levels. You measure when somebody has galactorrhea and amenorrhea, can only be improved if you add testosterone, because high prolactin levels can actually lead to osteoporosis because it induces an ovulation. So you don't have estrogen and progesterone. I'm talking about your natural estrogen and progesterone. So you have a higher risk. If you want to avoid that risk, even if you add estrogen and progesterone, especially in someone who has high prolactin levels, testosterone needs to be added as well. So testosterone has its direct effects by testosterone itself. The indirect effect is by conversion to DHT, dihydrotestosterone, and estradiol. Okay, dihydrotestosterone does not have a significant effect on bone, but is more on distribution of hair and sexual health. So if you have excess DHT because of testosterone replacement, you will have more body hair and you will lose scalp hair. That is a sign that you are not balancing your hormones. So it's good to test every 6 months, 3 to 6 months, the DHT levels in anybody who's on testosterone replacement. Estradiol is important for osteogenesis, including men. You need a small dose. This is the reason why we convert testosterone to estrogen. But unfortunately, most men, I hardly see someone who has within the normal range. If you take Gribbles, that's the lab I use as reference range, the acceptable range by the lab is less than 150 nanograms per ml. But healthy level should be 20 to 30. If the level drops below 12, men have higher risk of osteoporosis. So you still need a little bit of estrogen. Besides bone health, how does estrogen help for men? Any other reason? Probably otherwise we'll run around crazy because of testosterone. So nature has put in a little bit of estrogen to keep us under control. But you need a small amount, not a lot. A lot of estrogen is trouble for the prostate and heart and sexual life. So testosterone increases bone density. You can use it with finasteride. It prevents loss of cancellous bone, stimulates periosteal cortical bone deposition. And one of the best way, one of the most useful way testosterone helps in osteogenesis is by increasing osteoblast proliferation and differentiation, because osteoblast lays down bones. Testosterone also activates vitamin D. So this is another beneficial effect of testosterone. And of course, how do you find out testosterone deficiency even if someone denies all the testosterone deficiency? You don't do testosterone levels. The patient can't afford. Is there any other way, a simple way of finding out aging man who has testosterone deficiency? Can I have some warm water, please? They'll have low red blood cell count. They can be anemic. Aging men who are anemic, one of the reasons is testosterone deficiency. They can't do every other test. So low testosterone means low 25-hydroxy vitamin D. That leads to low serum calcium and also negative calcium balance. So when you replace testosterone, you give them testosterone replacement therapy, you will see these positive effects. Okay? But too much of estrogen is not good. So you still have to monitor estrogen levels as well. So if the DHT is high, you will have to correct it. If the estrogen is high, you have to correct it. Testosterone replacement is absolutely safe and a wonderful way of living healthier. But keep in mind that you need to monitor the other two metabolites. So the indirect effects of testosterone. So it has got direct effects either by testosterone or by conversion to other hormones. Indirect effects is testosterone is one of the hormones that is absolutely necessary for strength and energy. I'll show you, my lecture tomorrow is on testosterone deficiency in women. Most of that can be applied to men as well. If you are testosterone deficient, you have very little energy for exercise. The post-exercise recovery is very slow. When you have enough testosterone, you have more muscle mass, and I've already explained why you must have adequate muscle mass and muscle strength. If you are testosterone deficient, you procrastinate, you wouldn't exercise, you start giving reason. If you are testosterone sufficient, you will want to run to the gym. That's the difference. So these are some of the studies. This is a Dabo study on testosterone deficiency. 16.2% higher risk of vertebral and non-vertebral fractures among 55 to 95 years age men if they are testosterone deficient. But this is total testosterone. If you look at free testosterone, actually that does the work, and SHBG, maybe the figure would have been higher. This is another study, randomized controlled trial on testosterone TRT on bone density, risk of fractures, muscle mass, central obesity, impaired mobility, and lipid profile. When you do a randomized controlled trial with testosterone replacement, the final result was improvement seen in all these parameters. That is the reason why we call it king of the hormones for both men and women. Of course, we don't see women king. Any country got women as a king? No? Okay. They are not fair to the other half. Any reason why women cannot be king? No? Anybody knows? Is it because of testosterone being lower than men? Another hormone that determines the character is growth hormone. So when you replace hormones, don't look at just one hormone. If you hear about testosterone, it's not just about, thank you, testosterone. Hormones work in synergy, they work as a family, as I always say. Test as many hormones as you can and keep them in balance. correcting one hormone is useful, but correcting the rest of the hormones would be much better. Another study, 108 men over the age of 65, studied for 36 months, 2 groups, testosterone and placebo. And lumbar density was measured. Testosterone therapy improves bone density. That's the reference. Lower the pre-treatment levels, the better the improvement. So those who are very deficient will see a bigger improvement. But as I said, you have to run this trial for minimum of 6 months and above. If anyone tells you testosterone has no benefits on osteogenesis, either that is a synthetic testosterone or the dose used was not optimum and the duration was not long enough. So for females, the ovary is the primary source. Oophorectomy affects bone and heart health. It's not just this, it affects sexual health, it increases obesity, central obesity, and the risk for diabetes. Now, why do you think women have bilateral oophorectomy when they have a hysterectomy, even if the organs are healthy? Why? You choose to do, or we advise you to have it? We advise. Why? Because we don't want you to get another problem. So in that case, women should be like Angelina Jolie. What do you have to do? Any organ that is estrogen sensitive, if you are worried about cancer or tumors, you should have it removed. So you should remove the breast as well. Correct? So this is the cruelty. Because we don't understand the root cause. If someone has a fibroid, the size of a coconut, it doesn't disturb. You don't have to worry about it as long as you can monitor. Someone who has a moderate size of fibroid, if it causes severe problems, do a myomectomy. But the root cause is still estrogen excess. So you have to balance it with progesterone. Balancing it with progesterone before surgery makes the surgery very easy. In this country, we call it like kacang putih. So it's so easy because the moment you cut the uterus and squeeze it, it will come out. It pops out. That's as simple as it can get. If you don't do this, of course, you have to do a lot of cutting, there's a lot of bleeding. But even if you see a benign cyst or an endometriotic cyst associated with it, because it's still estrogen dependent, you don't have to remove the ovaries. What happens is when you remove the uterus itself, there is a 50% reduction in the blood flow to the ovary. So you already have a reduction in testosterone in women who have had hysterectomy. You have to watch them. Okay, this is why they suffer so much of ill health following hysterectomy. They are not the same again. We label them as psychotic. We have a psychological, sorry Sanjeev, my apologies. Sanjeev is looking at me, so I have to send my apologies that side. So we label them as, they have a psychological reason for that. Actually, testosterone, because it has such an impact on the way you think, on the brain health, so you become depressed. You have no positive attitude towards life, you don't have the zest in life, you don't have the enthusiasm, you procrastinate, and adding to that all other ill effects. So do not remove the ovaries unless it is cancerous. Okay? You want to do a surgery for cancer, that's a different topic. But if you want to remove the ovaries, do not remove it for for benign cysts or endometriosis. Don't remove the uterus. If it is a fibroid, you want to remove it, keep the uterus. Find a gynecologist who will remove the fibroid and save the ovaries for you. Because it has got serious consequences. Once you remove, they suffer. So what about as a replacement to testosterone? This is called selective androgen receptor modulators. They are called SARMs. And for women, we have the selective estrogen receptor modulators called SERMs. So they have their benefits. You have two types, steroids and non-steroids. I don't use them, so I won't bother remembering all this. You have it in your notes. They are effective, yes. Anabolic effects on muscle and bone, yes. Slight or no effects on prostate, positive point. Liver toxicity with prolonged use, so I'll be very cautious. Not a substrate for aromatase. So it doesn't become aromatase and 5-alpha reductase. So it doesn't become DHT or your estradiol. But the thing is that I don't want a hormone or a substitute for a hormone because, for just one benefit. Because testosterone does so many things in the body. So why would I not use natural testosterone? This is pharmaceutical industry. Because they cannot patent natural estrogen, testosterone, so they have to come up with something that does a little bit of testosterone work at the expense of cost and side effect. So I don't use this. Now, estrogen is very important for osteogenesis in men and women. A typical example is anorexia nervosa and amenorrheic women. They have higher bone loss. So estrogen declines from the age of 30 like most other hormones, but the problem is you have too much of synthetic estrogens both in men and women. Menopause is also associated with increased inflammatory markers, so that's how estrogen helps you. Estrogen, besides everything else, it suppresses inflammation in your body. But in men, you must have adequate levels, which is usually 12 to 20. Less than 12 is not good for bones, more than 30 is not good for the prostate and the heart and erection. So this is how estrogen works. It suppresses new osteoclast that resorbs the bone, down-regulates existing osteoclast, suppresses inflammatory cytokines, increases calcium absorption and retention time in the bones. So estrogen has more effects on the osteoclast, just keeps them quiet, not so much on osteoblast like progesterone. So this is SERMs, as I've mentioned. They have effects on bone. They have, but the effect on, why do you use estrogen? Because estrogen is very important in women for the bone health, for the heart health, for the sexual health, for brain health. Estrogen deficiency is also associated with Alzheimer's. So there is so much of benefits. SERMs will not do all this. So there are some products, raloxifene, is it Libida? They do not have all the benefits that a natural estrogen can do. So my feeling is the same. I would use something natural. I don't have to worry about side effects or toxic effects because I'm going to use in physiological doses and get the maximum out of it. I will not go to a synthetic replacement. Contraceptive pills, of course, they have to have reasons to sell. One of the reasons they tell you is that it is useful in bone formation, but the side effects is not worth it. More clot formation, more risk of heart disease, more risk of breast cancer, and it is more risk of depression. And contraceptive pills have a lot of effects on your adrenal hormones. Okay. What happens when you take OCP? It suppresses your ovarian synthesis of hormones. And what you lose? Testosterone from the ovaries. Actually, I came across an article that says if you take contraceptive pills, you reduce 7 of your natural hormones. So that's a big effect. Progesterone stimulates osteoblasts. Estrogen has more effect on osteoclast. Progesterone has more effects on osteoblast. Up-regulates the existing osteoblasts, but they work in synergy. It's also an anti-inflammatory and a reservoir hormone. So it can be therapeutic in osteoporosis, but you'll have to look at other hormones first. How do you identify a woman who has progesterone deficiency? From the history of menstrual cycle itself, or from recurrent miscarriages, or if someone has had ovarian cysts, endometriosis, and breast fibroadenomas, not breast cysts. Breast cysts is iodine and thyroid hormone deficiency, not estrogen excess. So these are the women who are at higher risk of osteoporosis later on in life. So similar to estrogen, the decline happens from 30 onwards. Menopause, there is a significant decline. The difference between menopause and andropause is, andropause, the hormone decline is more gradual. And pay attention to women who have all this, including those who have had recurrent miscarriage and recurrent premature delivery. Progesterone is also very, very vital for in utero ossification. 80% of fetal skeleton is mineralized in the 3rd trimester. And if you measure progesterone levels in pregnancy, the maximum synthesis of progesterone happens in the 3rd trimester. Okay? The maximum absorption of omega-3 fatty acids to the fetal brain also happens in the 3rd trimester. But the common advice from obstetricians and even some of the GPs is that stop taking omega-3 from 36 weeks or 34 weeks or 32 weeks onwards because of the risk of bleeding. So I have so many patients asking me this question. It doesn't happen. You have to take about 12 grams of omega-3 a day to thin the blood to a significant effect of causing bleeding, because 4 to 6 grams does nothing. This is the dose I use for patients in pregnancy, minimum 4 grams. The first thing I do when I notice in utero growth retardation, small 4 dates or IUGR, the first thing you should do is to increase the omega-3, and if you give them sufficient amounts, one thing you'll notice, in 2 weeks the fetal growth should improve and you have better skin, not dryness of the skin. If it doesn't happen within 2 to 4 weeks, you could add zinc and some protein drinks. That increases the growth hormone. So there are some protein drinks especially for increasing growth hormone levels. So first step is to use adequate levels of omega-3 and do not stop at 36 weeks. If you give them the 6 grams a day, you can continue that throughout pregnancy and during breastfeeding. DHEA, it has benefits on osteogenesis, but most of the studies that show the benefits are done at high dose, 50 milligrams. For a short period of time in women who are very deficient, this would be okay, but 50 milligrams a day in many women can cause oily skin or acne or facial hair. So it's a little bit difficult to use this dose in women. Some women won't tolerate even for 2 to 3 weeks. 15 to 25 milligrams would be the best. Okay. So DHEA has indirect effects because it can increase your growth hormone. This urinary N-telepeptides is a measurement of urinary loss. So the less you have, the better osteogenesis you have. The more levels, higher the levels, more osteoporosis you have. So again, this is based on 50 milligrams. For men, this is fine. For women, this is a little bit too high. So for women, you may want to reduce the dose or give it until they have an effect on the skin, oiliness, acne and hair. Now the trouble with hormones is that if you do not explain clearly to your patients, they'll come back or they'll be very, very unhappy. This is when you get into legal issues. 2 hormones always watch, including another hormone. One is thyroid. Tell them the signs of excess thyroid. Very, very important, because sometimes they get into the anxiety because of too much thyroid hormone. They go berserk. Okay? Advise them to stop and come back to you after a week or so. You halve the dose. That's the best you can do. That's the only thing you need to do, provided you educate them. They will never be angry because you have already explained to them clearly. Number 2 is DHA, the effects that I told you. Testosterone, if they have, of course, facial hair loss, scalp hair loss, that is too much testosterone, if they are on testosterone replacement or hoarseness of the voice. So recognize, understand some of these excess symptoms of excess hormone therapy, and give them the advice. Stop it, and when they feel better, halve the dose. So if a woman is on 15 milligrams and get all these effects on the face, It's not that DHA is toxic to them. You just stop it, but it takes about 3 to 4 weeks to clear. DHA is a bit longer. Then you give them 7.5. They'll be fine, mostly fine. But again, you have to give them the correct advice. Growth hormone is important for osteogenesis. Bone mass density loss is more significant in men. So growth hormone has more effects in men than in women. How do you increase the growth hormone levels? Number one, you must sleep early. This is the big problem. Unfortunately, children also sleep very late because everybody is glued to handphones. Okay. Number two, sugar will suppress growth hormone. So a high carbohydrate diet and sugar will suppress. This is the reason why diabetics age much, much faster. Okay. And there are some exercises in the gym that can specifically increase your testosterone and growth hormone. I'll show you some tomorrow. So I'll make sure you come tomorrow. That is, we leave it for tomorrow. Parathyroid hormone, this I'm sure most of you all know, it is also secreted in the thyroid gland, but by the chief cells. What it does is that it increases serum calcium. Just remember, parathyroid hormone is responsible for increasing serum calcium levels, okay? And calcitonin will do the opposite. When serum calcium level is high, calcitonin will bring the parathyroid hormone levels lower and it will lower the serum calcium. This works very fast. But basically, parathyroid hormone works on the osteoclast, but it has no influence directly. It has to work through the osteoblast through certain membrane proteins. Okay. So this parathyroid hormone has to bind to osteoblasts first. And then there will be expression of this rank L. This is a membrane protein which then blocks this membrane protein. And this, once this membrane protein is blocked, the stimulation of osteoclasts happens. Once osteoclasts are activated, it excavates the bone, releases calcium into the blood, and you have increased serum calcium. Once the level is up, then your calcitonin will be secreted, which will reduce the serum calcium levels. Otherwise, you will have too much serum calcium. Okay? So, assuming your parathyroid hormone, your calcitonin is all well balanced, if you have hypercalcemia, can you give me a reason why you get hypercalcemia? Vitamin D toxicity, that's one of the reasons that you should remember, because I'm sure all of you all are giving patients vitamin D3. But it does not happen in the normal dose that we use. Even if you use 10,000 IU, I use about 8,000 IU per day, I don't have hypercalcemia, I don't have vitamin D3 toxicity. That doesn't happen. If you use excessive dose, which means, as I said, 50,000 IU, for prolonged period, then you should watch. But in between, first of all, the safest way is to measure 25-hydroxy-D, okay? Then you have to measure again 3 to 6 months after the treatment, just to make sure that you are not, the patient doesn't have excessive levels. I have one doctor here who takes the normal dose and the serum vitamin D3 level is high. So this is the only person with the normal dose that I've seen. So it emphasizes that the importance of monitoring D3 levels. Sorry. Okay, the range that the laboratory range that I use Gribbles is 60 to 160 nanograms per ml, but the current recommendation is 75 to 250. Okay, so you don't have to reach the upper limit. Like most hormones, if you reach the 75% or the 25th centile, that would be sufficient. But again, monitor the vitamin D3 levels. Another benefit of parathyroid hormone is that it activates the 1-alpha hydroxylase enzyme, so you have more vitamin D3, and it increases in the absorption of calcium from the intestine. This we already know. So these are the patients you should watch for the risk of osteoporosis if they have hypoparathyroidism, which is quite common after thyroidectomy, or magnesium deficiency, autoimmune disease of thyroid gland, and vitamin D intoxication, which is not common but good to remember. So why do patients have surgical removal of thyroid? It is important if one has cancer of the thyroid gland. But otherwise, another common reason is when you have a goiter due to thyrotoxicosis. Okay? So majority of patients after the surgery will go into hypothyroidism. So you have to monitor. Even if you have someone with Graves' disease, there is what you call this cycle, isn't it? There's a time when they are hyper, then you give them anti-thyroid drugs, then they become hypo, you will have to give them thyroid hormones. But I don't use the drugs. Simply by removing gluten, and you test the serum thyroid levels 6 weeks, maximum 6 weeks, including the thyroid antibodies about 2 months, you will see a significant reduction in autoantibodies as well, provided you remove the gluten totally from the diet. This is my treatment for thyrotoxicosis. But I use a beta blocker if they have too much of palpitation, not anti-thyroid drugs. Because most of the women I used to see either pre-pregnancy, preconception, or early pregnancy, or intrapartum. So I don't use drugs. But even if I see any other patients for wellness, I don't use drugs. You remove the gluten. Number 2, most of the symptoms of thyrotoxicosis can be controlled if you correct their cortisol deficiency, which almost always coexists. Okay? So cortisol has a dampening effect on excess thyroid hormone. Hyperparathyroidism, too much thyroid hormone, someone has very labile hypertension, nocturnal hypertension, you may want to measure the parathyroid hormones. Of course, you can divide it into primary and secondary. These are some of the reasons why you can have hyperparathyroidism. The body is just trying to keep your serum calcium in the normal levels by producing more thyroid hormone. So this is body's way of managing acute events. It's very intelligent. It is the best computer you have. You can't make any computer better than that. So what happens is that when there is a situation, the body will only react to that situation and it will not think about long-term consequences. If your serum calcium is low, it will increase your parathyroid hormone. It just wants to normalize for that period of time. But if it is continuously low, then you will have hyperparathyroidism. And so you need to understand the reasons for high parathyroid hormone, especially vitamin D deficiency. Calcitonin is also from the thyroid gland, but it is secreted by the C cells. As I mentioned, it's just the opposite of parathyroid hormone. Its function is to reduce the serum calcium levels. Okay? So calcitonin, like parathyroid hormone, the action on the osteoclast is also an indirect action because osteoclasts don't have receptors for parathyroid or calcitonin. The purpose of using calcitonin is because it can reduce especially vertebral fractures, but this is a hormone that is not often used for osteoporosis, but it has got a very significant effect on pain, fracture pain. So if someone has got lots of pain because of fracture, you can use calcitonin to reduce the pain. It's not often used to correct osteoporosis. The recent research, osteoblasts secrete more hormone-like signaling proteins and osteocalcin. So if you want to have enough osteocalcin, this is calcitonin. Now I'm talking about osteocalcin. There is another signaling protein in the bone health that is called osteocalcin. This is recognized recently to be very important for health. Osteocalcin is produced by osteoblast. So in order to have enough osteocalcin, you must have healthy osteoblasts. And remember, osteoblasts can only function well if you have an alkaline body and if you have adequate hormones starting from puberty itself. So pre-conception, intrapartum, and early childhood ensure that the body is not acidic. And at puberty, there must be adequate hormones, there must be adequate exercise, sun exposure. All this must be in place for you to have healthy osteocalcin. Why? Because now we recognize that osteocalcin also stimulates insulin secretion. And it is very important for prevention and treatment of diabetes because it improves insulin sensitivity, reduces fat deposition, and it can also reduce leptin resistance. Calcitonin can also reduce obesity, high blood pressure, chronic inflammation, and atherosclerosis. So there are published papers on osteocalcin. Read them, and to have enough osteocalcin, I don't know of any supplements that increase your osteocalcin levels. The best way is to protect, as what we know now, is to protect your osteoblast health. And as I say, two things. Make sure you have adequate hormones. Make sure you have an alkaline pH in your body. So this osteocalcin, how it helps in osteogenesis is this. It does not allow calcium to go out of the bone by an action on matrix GLA protein that inhibits arterial wall calcification. So there are two reasons why you have calcium outside the bone. So this is called non-osseous calcification. One is vitamin K deficiency, the other is osteocalcin deficiency. Vitamin D, we have a few more slides, so we'll go through a bit faster. So this, we all know, we have heard many times. The point here is vitamin D acts in synergy with vitamin K. The current, the recommended dose is 600 IU per day is insufficient. Most experts now would recommend 4,000 to 6,000, even up to 10,000 IU per day, but just monitor the levels before and after treatment. So you have to measure, and the recommended level used to be 60 to 100, sorry, not picograms, nanograms, nanomoles. The current opinion is 75 to 250 nanomoles. If you want to convert to milligrams, you have to divide it by 2.5. So this is how you get this value in milligrams. Divide this by 2.5. Vitamin K, there are two types. One is from plants, it's called phylo. The other is from gut derived, it's called menaquinone, and of which there are two types, MK4 and MK7. MK7 has much better effects on osteogenesis than MK4. So the problem is we make very little. Humans convert K1 mostly into MK4, but MK7 seems to be more important. So MK4 is found in cheese, egg yolk. This is found in fermented foods. Okay? So cultures, almost all cultures enjoy fermented foods in different forms. You know, some eat fermented cabbage, Japanese eat this, we eat yogurt. So fermented foods had always been good for health. It decreases osteoclast activity, K2. And it increases osteoblast activity. It increases this protein, matrix GLA protein that I mentioned, that does not allow calcium to be deposited not only in arterial walls, probably also in bones and joints, including spurs. If you get spur, it is an extra-osseous calcification. Spondylosis can be considered as extra-osseous calcification. So you have to look for the reasons, and K deficiency could be the reason. Okay. It also increases osteocalcin. K1 and K2 also function as strong anti-inflammatory agents, and they have systemic benefits from these effects. So it improves bone health, reduces arterial calcification, reduces non-osseous tissue calcification, as I mentioned. Breast calcification is very, very often seen in women who go for ultrasound. Avoid mammograms because it's highly toxic to the body. Arterial calcification is also often seen. In fact, atherosclerotic plaque often has calcium. It's not just cholesterol. I'm sure all of you are aware. It has to be oxidized, then it attracts calcium to stabilize the plaque. Then you have platelets and many other components in the plaque. So it's just not cholesterol. K2 can reduce fractures significantly. So now there is a lot more evidence that is pouring into the benefits of having adequate K2 levels, but the problem is we don't seem to get enough from food. So it's better to supplement, and this is the dose that you can take. Okay. 0 minutes. Can I have another 5 or 10 minutes? Okay. Vitamin B is important because it keeps your homocysteine at healthy levels. I don't know of any other direct benefit of vitamin B in osteogenesis. It could be an indirect benefit by keeping the homocysteine at a healthy level. Okay. Now, homocysteine has a lot of effects. It increases apoptosis of osteoblasts, so these don't last long, activates osteoclasts, affects the collagen cross-linking, increases chronic inflammation. And you know how to keep the homocysteine at healthy levels. Vitamin C, especially because it increases collagen formation. Bone protein is a lot of collagen in it. Stimulates the production of osteoblasts, and vitamin C is good at reducing inflammation. Okay. So the adult recommended dose should be 6 to 10 grams or at least 4 to 6 grams. The minimum you can take is 1 gram 3 times a day. Anything less than that will not have much of an effect. Calcium we all know, but what I want to show is this. There are different types of calcium. Natural calcium is bone meal, oyster shell and all this, but the problem is heavy metals. Then you have calcium carbonate. This is a calcium that is commonly sold. It's not natural form. It will not be absorbed well, and it may not go to the bone. So you have chelated calcium, that would be the best. Okay, it will be citrate, malate, gluconate and aspartate. This would be the better form of calcium to take. So a good formulation of calcium. Hydroxyapatite is bone derived. Calcium and phosphorus is in. There are also growth factors and trace minerals. It is well absorbed, but it's expensive. So the dose should be up to 1,500 milligrams per day, higher dose in pregnancy and breastfeeding. Make sure during growth spurt there is enough calcium in children. Vitamin K2 and D3 should be taken as well. Please do not take calcium alone. A good bone formula should have the calcium in this form, okay, chelated minerals. You should have D3 and K2, and you should also have other minerals. Only then bone formation will take place. Never take calcium alone, and don't take calcium carbonate. Now, once all this is there, you need your hormones to activate the osteoblast and suppress the osteoclast. The drugs that are used for osteoporosis works this way. They suppress the osteoclast. They have no beneficial effects on osteoblast. So what you do, what happens is when you suppress the osteoclast, there is no excavation. There is no removal of dead bone. When you do the assessment, it appears on the scan, DEXA, anything that you do, it appears to have better bone mass, but it's not healthy bone. It is dead bone, so it still fractures. So the idea of bone building is with vitamins, minerals, and hormones. Magnesium, we can skip. We all know how it works. But another benefit of magnesium is it decreases skeletal substance P, which is pro-inflammatory and osteolytic. It also regulates your parathyroid hormones and calcitonin. This is important, and decreases the excretion of.
Question regarding the dosage of calcium. When you say up to 1,500 milligram, is it the calcium that you take or the elemental calcium?
This is the chelated mineral. The elemental calcium will be lower than that. So if you are deficient in magnesium, you will also have a higher risk of other associated diseases that we all are aware of. So do not use magnesium oxide, which is the common supplement that is available. It is again better to use the chelated minerals, better bioavailability. Now a word or two about boron. It has been recognized now that is vitally important for human, plant and animal health. It is important for growth and maintenance of bones. It improves wound healing. It boosts magnesium absorption, reduces inflammation, increases these three antioxidants. Yesterday I mentioned that there are three intracellular antioxidants. You have glutathione, you have catalase, you have SOD. They all have their individual functions, but the master is still glutathione, because once you have adequate glutathione through the NRF2 pathway, it can stimulate the SOD and catalase. So you can take care of the superoxide anions. You can take care of hydrogen peroxide, which is not actually a free radical per se, but you can also take care of hydroxyl anions, because it's a most vicious form. So when you have adequate glutathione, you take care of so many types of free radicals. So I prefer just one antioxidant, intracellular antioxidant, but you still need some antioxidants that work on the lipids. That's your cell membrane, your LDL and so on. That's where vitamin E works. That's where your lipoic acid works. You also need a antioxidant, water-based antioxidant that works in your blood. That's vitamin C. Alpha lipoic acid is both water and fat soluble. So it's a very good form of antioxidant that you can consume. But boron seems to activate all the intracellular antioxidants, protects against pesticide and heavy metal toxicity. So there is boron deficiency in the soil. That aggravates the toxicity of pesticides and heavy metals. It improves cognition and memory, increases SAMe and NAD levels, helps in the treatment and prevention of cancers. Iodine is also associated with, iodine deficiency is also associated with cancer risk, reduces chemotoxicity. You can Google, there are many articles on boron that is appearing now. Boron and osteogenesis. These are all the reasons how it helps in osteogenesis. The dose is 2 to 10 milligrams per day. You don't see toxicity unless you take more than 100 milligrams per kilogram. So something that is natural, the safety range is so wide, but it's not so with drugs. So read on boron. These are all the references that's in your notes. Exercise, as I have emphasized just now, the exercise that builds muscle and bone. For bone, you can have impact exercises, but for muscles, you have to have resistant or weight-bearing exercise, aerobic or swimming. But swimming is something that I don't encourage, because if you go to the pool, you get more chlorine toxicity rather than the benefits of swimming itself. Okay? So, this is the end of the lecture. Thank you very much.